Grace, I'm starting to record now.
Hi everyone, and thanks for joining me today. In this presentation, I'm going to share how we implemented the assessment and management of pressure injuries for the Interprofessional Team Guideline and how we engaged our champions. Next slide. A little about my facility. Grove Park Home is a long-term care home located in Barrie, Ontario. We opened our doors in 1968 to those looking to retire. Since then, we've expanded and are now home to 143 residents varying in ages from 43 to 106, all with varying degrees of care being required. In addition, we also offer 14-bed retirement living suites and an adult day program. Over the last few years, care staff have seen residents arriving more frail and with increasingly complex care needs. We are known as having the gold standard for working with responsive behaviors, something that is more common every year. As care becomes more complex and more demands are put on our sector, our staff of nearly 200 must learn and adapt, new equipment and new processes must be acquired, and our standards of care must continue to grow to meet the needs of those in our care. So what makes us special? What makes us special is that we are the first long-term care home in LIN 12, which is North Simcoe, Muskoka, to be designated a best practice spotlight organization. We are the second healthcare organization behind RVH, which is the first facility in this area. During our pre-designation period, we implemented the Person and Family-Centered Care Guideline, the Prevention of Falls and Fall Injury in the Older Adult Guideline, as well as the Oral Health Guideline. These are all maintaining sustainability currently. The first guideline we implemented post-designation was the Assessment and Management of Pressure Injuries for the Interprofessional Team. The first step in the implementation process of the guideline was the completion of the gap analysis. Some key points when completing the gap analysis are to ensure you can dedicate the time needed. We took over 2 hours to complete ours. You should try to include everyone on the steering committee, as well as any team members who want to give their input. As you can see from the photo, it's important to make them as detailed and enter as many examples as possible. Some of the biggest areas we identified after the completion of the gap, including assess using a reliable wound assessment tool, identify signs of infection, lower leg assessments, repositioning and offloading, education programs, and assessing healthcare knowledge. Once the gaps have been identified, the next step is to complete the action plan. This allows you to identify, prioritize, and determine the next steps to address the gaps moving forward. The first way we planned to address the gaps was the launch of the new guideline. The goals for the launch was to introduce staff to practice changes to come, provide education on wound care, education on dressing kits, changing the assessment tool, as well as to ensure we deliver interactive demonstrations for staff to boost interest, keep attention, and encourage participation during the event. The second way we planned to address the gaps was to provide staff education. We offered weekly and monthly education to registered staff, as well as monthly education for PSWs. Lastly, we assessed healthcare knowledge with a quiz. This was completed prior to the 4-part in-service and then afterwards to see if staff had improved knowledge on wound care. The first way to address the gap was the launch of the guideline. The first steps to a successful launch is plan and promote your event. We send out emails and we hung posters throughout our home to make everyone aware. We also utilized our RNA coach Frida to send out invitations to other homes, as well as we invited our community stakeholders and community partners. Our launch was held October 30th and it was Halloween themed. This event was open from staff from 9 a.m. to 3 p.m. These hours allowed for staff on days and evening shifts to attend. We encouraged all staff from nursing, activities, maintenance, and management. Each station had a basket of candy that staff could put in their trick-or-treat bags as another incentive for attending. As we were fortunate to receive open house funding for this event, we were able to have it catered with both a hot breakfast of oatmeal with a variety of toppings if you came in the morning, or 2 choices of a hot lunch, including Thai soup or chili with a bun if you came after lunch. We have found that providing food, hot food in particular, greatly improves our staff attendance. We start with most of our BPSO events with the same trifold display boards. These 2 boards show the basics of the program and what it takes to be a champion. This is especially important for new staff who may be unfamiliar with the program as a way to learn about it. This slide shows a clearer photo of the initial display board. As mentioned, this board describes the basics of the BPSO program, the deliverables required, and the 3 guidelines we implemented with their recommendations. And here's a clearer photo of the champion display board. This is the first recruitment technique we use for our staff interested in becoming champions. Here they can learn what it takes to be one, as well if they're interested in attending the NAO Champion Workshop. The first wound care education that staff received during the launch is on this board. This one shows skin tear classification, positioning and offloading, staging of pressure injuries, and the Bates-Jensen wound model. We use our residents' wound photos for impact on staff. We have found this increases interest and validates the need for these practice changes. This table displayed some additional practice changes, including offloading boots, PSW dressing kits, and the Seymour wound care model for practicing of dressing changes. As you can see, we try to keep our displays very visual and encourage hands-on when able. Our PSW dressing kits on the left are provided to those staff who are trained and have shown competency with applying simple dry dressings. These staff trained, after bathing their resident, are to apply a dry dressing to the site. The goal is to ensure wounds stay clean and at optimal wound healing temperature before the nurse is able to apply the appropriate dressing. And on the right is the Seymour wound model. This has been useful with assisting staff with education on wounds, primarily staging of pressure injuries, as well as with dressing application. We introduced staff to the Bates-Jensen wound assessment tool, which is going to replace our current assessment tool being used, as it was proven that is not validated for use in long-term care. We had large laminated printouts made that were on display for staff. These will later be placed on the units as visuals when this is implemented more throughout the building. A bed in the center of the room with another hands-on display we set up. Staff are able to use pillows, blankets, and wedges to show correct side lighting position and how to offload these areas most prone to breakdown of someone when lying in bed. Here you can see how we applied cutouts to the bony prominences on a staff member. This was to show the correct positioning and how all areas can be offloaded with proper sideline positioning and the use of wedges, blankets, and pillows. As with other launches, we always represent our other teams with a display of what they're working on. Here includes the fall prevention team with their focus on purposeful rounding, and the person and family-centered care team with their focus on the wishing wells and our welcome baskets. As incentive for staff to complete the survey of the event, we have door prizes available. This time we offered buckets of candy with a movie pass. By completing the survey, staff received a ballot to write their name on, and at the end of the day, we held a draw. We also used this time to recruit for our teams with SignUp Sheets. Here's an example of one of the SignUp Sheets that we used. We were successful with recruiting more than 20 staff members from all departments for the new Wound Care Best Practice Guideline team. Two of the questions asked on our survey included the quality of the presentation as well as information presented was beneficial to their role. As you can see, the results were quite positive. Some of the general comments included delicious lunch, great information, and learned a lot of new things about stuff I never thought about. Overall, this event was well received by everyone who attended. The second area addressed included champion involvement. Our functions run smoothly thanks to all of our champions who help out and volunteer their time. We include them in all aspects of planning the activity and encourage them to attend and assist on the day of the event. Our champions are recognized with t-shirts and pins for their contribution to the program. All of our teams, including our wound care team, are multidisciplinary and include registered and non-registered staff, life enrichment, management, and maintenance staff. We encourage all team members to have an active role within the team. They are volunteer-based. Staff are not paid for their time to attend meetings. We try to keep our meetings short to roughly 30 minutes, and these are held once every month, up to every 6 weeks. We encourage those staff who are interested in active team members to attend the one-day NAO Champion Workshop to be recognized for their roles. Following the launch of the Wound Care Guideline, 5 staff members attended the Champion Workshop in Newmarket. This brought our numbers to greater than 25% of our staff as official RNAO champions. The third area addressed included staff education. It was identified with the gap that an area lacking was staff education. As a result, a series of in-services was completed in the summer and the fall to both registered and non-registered staff. Posters were placed throughout the facility and emails sent to staff announcing the event prior to the day, encouraging them to attend. These were received well, with many staff coming in on their own time. The first series of education completed was for registered staff. The topics: staging of pressure injuries, stages of wound healing, signs of infection, and terminology for documentation. These in-services were held over the lunch break. A meal was provided for those who attended. Again, this increased our numbers with the promise of a hot lunch. These lectures were kept purposefully short to roughly 15 minutes and always included a hands-on aspect. The next in-service was about skin tears and focused on classification, healing times, and treatment options. Tomatoes were used to show the importance and how to approximate a skin flap. And like the ones held previously, we kept these short with 15 minutes of education, and then your meal was served to staff. The last in-service for the year was on venous wounds. This included the importance of and how to apply compression, and similarly to the ones held previous, the information was condensed and a meal was provided. We had a lot of PSWs request education as well. Due to the numbers of PSWs we have, these were arranged over their 2 lunch breaks over a 2-day period. So as many staff as possible were able to attend. We were able to serve snacks to those who came. The first in-service was on staging of pressure injuries and included the use of an apple as a visual representation of the stages as you slowly cut into it. The second in-service we had was on repositioning and offloading. Again, we involved the bed, similar to the one we used during the launch. We also used a wheelchair to show proper seated positions when wounds were present. As with the previous, this one was held over their lunch breaks over the 2 days. The fourth area we addressed was on assessing healthcare knowledge. One way we assessed healthcare knowledge was with a 20-question quiz. This was administered to staff prior to the start of the series of 4 weekly in-services in July. It was kept, then returned to staff for them to complete once they had attended all 4 sessions. Our goal was to show an increase in knowledge gained. And as you can see from the graph, every staff member who completed the quiz and attended the sessions had an increase in knowledge ranging from 5 to 45%. Moving forward, our plans for the future include continuing to enter data into Enquire. We post these results on display for all staff. We also plan to continue with quarterly education for both registered and PSW staff once restrictions are lifted. Some ideas that have been requested include compression therapy for PSWs, additional training on the Bates-Jensen wound assessment tool, as well as how to complete a lower leg assessment. Lastly, these are the scrubs we had made and we wore for our launch that day. Each one represents the team that staff is part of being their superpower. Thank you everyone for listening. Were there any questions?
Well, thank you, Allison, for that excellent presentation. And I love the use of pictures. And it's obvious that you and your team have put in a lot of work to develop these educational sessions that are interactive and relevant and meaningful to the staff. And the champions really are proud of the work that they do. And there's that collective identity when it comes to, making it's almost like t-shirts that are branded. And also I really like the acknowledgement of and the celebration of the work that is being done, and also the use of evaluation when it comes to making improvements, and they're able to showcase the great work that everyone's doing. So thank you so much. So we do have some questions. Again, please feel free to write in the chat box the questions that you have, or if you're brave, you can also unmute yourself and you could also ask the question. But we do have one question, Allison, from Amy Baker, and she's asking, how do you keep the sessions within 15 minutes?
We tend just to keep the education aspect of the PowerPoint as quick as we can, usually 10 to 12 slides. And then usually we'll do lunch after, because then that will fill up the rest of the lunch break. But if we get them first just for the education bit, condense and shorten it as much as we possibly can.
Okay.
We found that was a good way to get them to come, saying it was only a 15 to 20 minute top presentation.
Okay. And then when would the hands-on component come in? How would you fit that in then?
Usually even also while they're eating.
Oh, okay.
Yeah, we sort of blend the two together. We did, like I said, we've done the apple with staging of pressure injuries. We did the tomatoes, but we would bring in lunch while they're practicing as well, just to try to keep it as condensed as possible.
Okay. Okay. So Amy, hopefully that answers your question. And of course, if you have any other questions, please write them down.
Oh, hi, it's Connie. I just have a comment. Allison, I'm really impressed with the different strategies you used for education. I can certainly see where it met all the different learning needs of the staff. And that was brilliant. Thank you.
Thank you very much. Yeah, that's our big goal is recognizing different people learn and try to make them visual, try to get the hands-on, try to keep the interest. That definitely is a big part of it.
Yes, so important.
Thank you, Connie, for those comments. And there is another question here. What follow-up have you done with the champions post-launch? So you talked a lot about the launch and the importance of being able to bring awareness to the work and showcase the work that's being done. And you show that there are some components of education. What else have you done in terms of after launch?
A big part of it is our meetings. Everybody who signed up is considered part of the team. Whether you want to actively attend a meeting or more passively just support the team. So we do meet as often as we can, which is a lot less than we want it to right now because we're not allowed to meet in large groups. Definitely, like I said, is attending the meetings. And right now, like I said, we had our 5 staff attend the Champion Workshop, and we're hopeful that when we host, if we host this year, that we will be able to send more.
Okay, excellent. Well, thank you. It's definitely a lot of work, effort, and it's clear that you have, you and and the champions, the staff have a clear vision, and obviously you clearly identify the gaps and the needs. So it's quite evident in the interventions that you put into place and the education that you put into place. And there is another question here from Ben. Was there a steep learning curve for PSWs and the use of, simple dressings post-shower or bath?
A lot of them really were interested. Like I said, I've only got about 3 so far. Again, those were the ones who came to the education sessions. So they had a grasp of it, and it's a lot of hands-on. We do small groups with them. they show a lot of interest in doing it. And those are the ones who are putting on those simple dressings. We practice on a heel. We practice on the Seymour wound care model until they're comfortable to enough to start doing it on their own. Like I said, this is quite new for us. Maybe last month we just started, but they're super proud of themselves when they'll email me or they'll call me and tell me that they've done this. They would like me to come and see their work. Yes, they're doing quite well with it. It's a small group still right now, but we're hoping to expand throughout the year.
Oh, that's amazing. I love the enthusiasm and the support that you're able to provide them. And other champions are they also, available to be able to support the PSWs in terms of perhaps they need some added support or just wanted someone to check their work when it comes to applying a simple dressing?
Absolutely. The register staff is always around as well. So like I said, this is just a temporary dressing just to keep that area covered. It's not an official, it's not a proper dressing.
Yeah.
Just to keep that area covered until the nurse has time to get in there. So it's good for the wound, it's good for the staff.
Yeah.
And then absolutely, I'm in the building, our nurse practitioner, as well as the register staff on the floor have been really receptive to helping them.
Okay, awesome. Yeah, it's a skill that, you can't just learn by listening and watching. You definitely also have to practice it as well. So I really appreciate the various ways and the creative ways you've used to be able to teach them. Okay, so Ben says, thank you, great presentation. And then Wilmer says also, amazing presentation, awesome, and creative teaching interventions, which definitely is the case. So we test knowledge gain, but do we assess if knowledge is being applied?
Interesting. Can you repeat it one more time, the question?
Yeah. You test knowledge gain, but do you assess if knowledge is being applied?
Much harder to do.
Mm-hmm.
I know a lot of staff, I do a lot of on the floor in servicing as well. Or they'll come in, they'll walk around with me and we'll do wounds together. But much more harder to see if what they're taking they're actually are learning from.
Mm-hmm. Mm-hmm. Is there perhaps any proxies or any measures in terms of improvements in different things, or maybe chart audits to see if things, things have been, activities have been done, or?
We are seeing a drop. I do track for Enquire as well as just our own data. We do track monthly our pressure injuries, any kind of wounds that we have. Too soon, I think, to notice any significant changes because it is such a new implementation of things that we've done so far.
Yeah, definitely. But you have it sounds like you have a good process in place to be able to track processes and outcomes. Okay, awesome. Does anyone else have any? Oh, Vanessa, very good presentation. How do you continue to keep the champions engaged in their BPG?
We give a lot of them roles, which is a big part of it. So long as they feel they have a role, they definitely stay engaged. They love education. I encourage them to attend outside education as well as I'm hoping to attend and get more education going. They're really excited to be doing the PSWs, to be doing the dressings. And they just have other roles. Another role they may have would be to keep their dressing kits fully stocked. I also take them on wound rounds if they're interested and they're free. Once a week I go around and see the different wounds in the building, and a lot of them will come with me just to watch technique, just to see how things are done. But definitely a big part of it is giving them a role and keeping them interested.
Mm-hmm. Mm-hmm. And so you talk about the importance of champions having roles in order to keep them engaged. I'm just curious of what kind of roles are available for champions for this BPG in particular.
For this one, like I said, the big one is the PSW doing the dressings. Keeping the dressing kits stocked is important as well. Make sure it gets clean. We also, other roles they will be helping do the in-servicing and doing the education. They can help collect data. I have a bulletin board that I display the data on, and they would be responsible for updating the data board.
Oh, that's good. Okay.
Like that, yeah.
Yeah. Okay. Awesome. And just in relation to current practices or best practices, do you have any ways of keeping champions up to date on current practices in relation to wound care? Because I saw that you covered not just pressure injuries, but venous leg ulcers, skin tears. There's a lot that goes on in wound care.
I love education, so I take absolutely whatever education is available for me, and I love teaching. So whatever I can learn and teach to others is my goal. Keeping up to date, I think, is important for anybody, and I'm hopeful I do that with all the courses that I take.
Mm-hmm. Okay, and is there any sort of courses that you would recommend?
I actually just finished the University of Victoria, both of the level 1 and level 2 wound courses. They were challenging but phenomenal courses. Really recommend them.
Okay, excellent. So Vanessa says, excellent, thank you. Amy Baker, she has another question. Was there any pressure from the union regarding staff not being paid for their time to participate?
We are not a unionized home. We're just a little standalone home in Barrie. And again, it was volunteer based. So a lot of the times we held our meetings from about 1:45 to 2:15. So they would be off their floor for 15 minutes, and then 15 minutes of their own time would be how we would have our meetings. And again, that's why we have some participation who choose to come to meetings, others who choose more passive. They'll come to me and just ask for an update because they weren't able to attend or they couldn't stay that day.
Okay. Okay, excellent. Any other questions that individuals may have that you could write in the chat box, or if you would like to, you could unmute yourself, or any comments? So Allison, how long have you been in like a BPSO? And for individuals, I had not explained what BPSO is, but it stands for Best Practice Spotlight Organization. So it is a program that's run through RNAO, a formal program where organizations such as Park Grove Home do enter into a partnership with RNAO to be able to systematically implement 3 to 5 BPGs. And they do this with us over a period of 3 years. So
yeah, we just finished our 4th year. So our 3-year designation period, and then we just finished our first designation period.
Oh, amazing.
In April, yeah. And we've implemented, like I mentioned earlier in the presentation, we've implemented 4 guidelines so far.
Oh, wow. So how do you, I mean, that's a number of guidelines. I know the focus of this is pressure injuries, but then you had also mentioned, I think it was PFCC and falls. Is there, how do you sustain all of that? That's a lot of work. How is all of that kept?
We have great teams. So each guideline basically has a team lead, and then they have a team under them. So they all work well together. Okay. And then all the leads, we get together maybe quarterly and just discuss our plans moving forward. So I sort of oversee, as a liaison, oversee the program at the home. And then I have a lead for each of my teams. And then each team has a set of champions. Okay. Who are responsible for those obligations for that team.
Okay. Okay, so there's like a structure in place. So you have, I guess, BPG leads and then their teams. Yes. And then the BPG leads, you work with them as the BPSO liaison within the home.
Yes.
Okay, excellent. Well, I mean, the structure also, I think, is important in terms of maintaining the momentum, and it sounds like it's been sort of put in, like integrated into part of the home. So I love it. So Heather Woodbeck, she says, I love how you have used such interactive education opportunities. That is best practice for educating adults, which I definitely agree. And Wilmer says, have you ever experienced resistance regarding the implementation of the guideline? And how do you assure that you receive buy-in from staff in regard to a guideline?
I think the biggest one we held resistance for was the oral care guideline. Falls and person-family centered care were taken really well with most of the staff. Oral care is probably the one we struggled with the most. It quite flopped. We are relaunching it with a new team lead, and we're hoping for success. Our goal is just sort of see the positive in it, encourage the positivity, forget the naysayers, and push ahead with the practice changes that we want to make.
Yeah, yeah. Well, I guess in anything, in any practice change, there is always going to be people who are going to be resistant, but it's a matter of doing your best to meet them where they're at, perhaps persuade them to invest in it. If not, you don't need 100%, I guess, buy-in to be able to proceed with anything. Maybe some individuals need to be able to see that it's a success or it's going well for them to come along. So yeah, there's different different ways of responding to change, for sure, that I think we all can appreciate. Okay, excellent. Any other questions that anyone has? I know we only have, maybe 5 more minutes to go. But Allison, is there any lessons learned or any comments you would like to share in terms of what you've done and what you'd like to be able to impart on other champions and leads?
I think one of the big lessons we learned was to see what else is going on that day. Unfortunately, we found after that we booked the launch the same day that there was a large dementia education day going on. So a lot of other facilities who wanted to attend couldn't attend because they were obligated to go to that other function. So I think just making sure you check that nothing else is going on at other homes so that it is available if they would like to attend. Would be definitely one of the big lessons we learned for this event.
Yeah, but definitely there's a lot of things going on, and just be able to align and coordinate with other initiatives so that people don't feel that they have to choose, or you don't get the kind of turnout that you expect.
And food works fantastic for our staff. Hot food rings. We will get 60-80 people, which is pretty much our whole staff for our staffing ratio for the day.
Wow.
If we serve them hot food and candy.
Okay, that was also a consistent theme in your presentation. Food was a big incentive.
Yeah, absolutely. If you can provide a hot meal, you double your numbers.
And in terms of being able to provide, hot meals and such, I know the one you had tapped into a Champions Open House, which is something that our NAO also has offered in terms of being able to support, events where there's community networking and such, and essentially what it is, an open house. But how else are we able to secure sort of the resources to be able to, because I'm sure in addition to the food, you have the different kinds of materials and supplies, and I know those models of, I know we call them butts in a box, but it's, those of the wounds and different body parts. Those are not cheap. So what are the creative ways that you have gone about in order to secure this kind of resources?
The wound model was Dragon Boat funding. I put my request in, did a lot of begging and pleading, and was able to receive the Seymour butt with the Dragon Boat funding. We do fundraising every winter as well with like a craft sale. So little ways like that. We also, resident council donates some money to the program as well. And we're able to, it usually won't be as elaborate as this one was. This one was, thankfully, because we had the champion funding, we were able to do a little bit more. So the other ones are usually toned down a little because we are paying for them.
Yeah. Okay. Well, excellent. Well, Allison, thank you very much for that presentation and for giving your time to answering all of our questions. It's definitely, you are a success story and an exemplar of what successful BPG implementation and thinking outside the box and using creative strategies in terms of engaging champions in meaningful roles when it comes to BPG implementation. So I thank you very much to you for attending, and also thank you very much everyone online for attending as well. Unless you have any remaining questions or comments, I think we'll bring this to a close. So I'm just going to check one more time. Okay, well, thank you everyone for attending. Thank you, Allison, as well. And what we're gonna do is that this is recorded, so it will be posted on the RNAO website, and everyone who is registered online right now is also gonna get a PDF copy of Allison's presentation, and she has included there her name and her contact information. So you're welcome to reach out to us or to Allison directly with regard to anything else. So thank you very much, everyone. Have a great afternoon and have a great day.
Thank you, everyone.
You're welcome.